If there are no other items of business, I've got a really good story to kick off the week that should get you thinking about how we can do a better job to connect with our patients and their families. As you're listening, be thinking of little things you can do that will be appreciated and perhaps make a big difference. So here's the story.
At close to 1 a.m., Celia Roberts, a nurse, was walking down the hall when she heard what sounded like sobbing coming from room 337. The patient was Harry Saunders, a nice man facing fairly serious surgery for a rare heart condition. She poked her head into the room, letting in a sliver of light. Mr. Saunders was sitting up in the dark, crying. Celia came in and sat on the edge of the bed and took his hand. She comforted him for nearly 5 minutes until his sobs subsided. "Tell me what's going on," she said. "I'd like to know." He took a deep breath. She could feel him let go a little. "That's good. Whatever you're feeling is just fine. If you'd like, I'd love to hear about it. I've got all the time in the world." Mr. Saunders began to speak haltingly between sobs. "You know, I can't remember ever being this afraid."
Interestingly, just a week ago, I had this happen with one of my patients. So what can we learn from this story? Can you think of something that you might experiment with in the coming week that can help our patients feel that we support them emotionally?
Story Care. It's that simple. Just 15 minutes of huddle time every week encourages teams to zero in on behaviors they can easily add to their routine. These become their best practices. They own it, which is the key to organization-wide transformation.